Welcome to Raw Online. I am Dr. Lavanya Devi, Assistant Professor of Anatomy. Today's topic of discussion is cubital fossa. Cubital fossa, it is a triangular depression which is present in front of the upper end of the forearm. So this is the area for cubital fossa. In Latin, cubitus means elbow. It is also called as antecubital fossa. I am going to discuss the cubital fossa under the following subheadings: boundaries of the cubital fossa, contents and clinical anatomy. In the boundaries, it is a triangular space. So it has a medial border, lateral border, base and apex, as well as it has roof and floor. First, we will see the boundaries. The base of the cubital fossa is an imaginary line which is extending from the medial epicondyle. This is the area of medial epicondyle to the lateral epicondyle, and this is the place for lateral epicondyle. This is the base of the cubital fossa. And the infromedial border. The infromedial boundary is formed by the lateral border of the pronator teres muscle, and the infrolateral border is by the medial border of the brachioradialis muscle. This is the brachioradialis, which forms the lateral border. This is the pronator teres, which forms the medial border. And the apex of the triangle is directed below. The apex is formed by the overlapping or the convergence of brachioradialis and the pronator teres muscle. So the base is an imaginary line extending from the medial epicondyle to the lateral epicondyle, and the apex is directed below, which is formed by the convergence of the brachioradialis and the pronator teres, and the medial border is formed by the pronator teres and the lateral border is formed by the brachioradialis. Coming to the roof of the cubital fossa is mainly by the cubital fascia. Cubital fascia is nothing but a deep fascia which is present in this region. Actually, it is a continuation of the brachial fascia from above and antebrachial fascia from below. The roof is reinforced by the bicipital aponeurosis, which is extending from the tendon of biceps. In the roof, we can see the some of the structures. Superficial to the deep fascia is the median cubital vein. This is the median cubital vein. This is the connecting vein. This is the medial aspect and this is the lateral aspect. So this is the connecting vein between the cephalic vein laterally and basilic vein medially. So the important structure in the roof is median cubital vein. As well as we can see the some of the cutaneous nerves, medially by the medial cutaneous nerve of forearm, laterally by the lateral cutaneous nerve of forearm in the roof. And also we can see the median vein of the forearm. The median vein of the forearm is formed from the dorsal venous plexus and it reaches the median cubital vein, as well as sometimes it connects the basilic vein or to the cephalic vein. So the structures in the roof that is superficial to the deep fascia is the median cubital vein, medial cutaneous nerve of forearm and lateral cutaneous nerve of forearm, as well as the median vein of forearm. Superficial to this is the skin. So these structures are located in the superficial fascia. Coming to the floor, the muscles which are closely related to the bone forms the floor. This is the lower end of brachialis. The lower end of brachialis muscle forms the upper end of the floor. So this is the brachialis and this is the supinator muscle. The supinator forms the lower part of the floor. So the upper part of the floor is formed by the brachialis muscle and the lower part of the floor is formed by the supinator muscle. So that's all about the boundaries. So the cubital fossa has base. Base is an imaginary line extending between the two epicondyles, and the apex medial lateral borders roof and floor. Coming to the contents. From medial to lateral, this is the medial lateral. The contents present in the cubital fossa from medial to lateral are median nerve, brachial artery, tendon of biceps, and radial nerve. The radial nerve lies deep to the brachioradialis. So, the contents from medial to lateral within the cubital fossa are median nerve, brachial artery, tendon of biceps, and radial nerve. Then, first we will see the contents one by one. First is the median nerve. Median nerve is the medialmost structure which present in the cubital fossa. It descends from the brachial plexus. It won't give any nerve supply to the muscles in the arm. It reaches the cubital fossa, descends downwards. It lies medial to the brachial artery. This is the brachial artery. This is the median nerve. So the median nerve is the medialmost structure. It descends downwards and leaves the cubital fossa in between the two heads of the pronata teres. So we can see the cut end of the pronata teres here. The pronata teres has humeral head and ulnar head. So the median nerve leaves the cubital fossa in between the two heads of the pronata teres muscle. It lies medial to the tendon of biceps and brachial artery.